Welcome, everybody. We are going to have myself, Janet Chee, the Associate Director of the Long-Term Care Best Practices Program, as well as Sue Sweeney, the Program Manager of the BPSO Long-Term Care Best Practices Program, presenting today. We also have some guest speakers who will be joining us during this presentation. Now, today what we're going to be talking about is the Best Practice Spotlight Program, and in particular with relation to the long-term care program. And so we're going to be talking about what BPSO is, why it would be a fantastic opportunity for a long-term care home to join and submit an application, and really looking at what are those deliverables that a long-term care home would need to commit to. And so we are going to be taking questions at the end of the session. And so definitely hold on to your questions. You could also type them in the chat. So RNAO is the Professional Association of Registered Nurses, Nurse Practitioners, and Nursing Students in Ontario. One of our biggest mandates is really to provide a strong and credible voice, really advocating for healthy public policy. Our second big part of our program is the Best Practice Guideline Program and Best Practice Spotlight Organization Knowledge Movement. And so that's what we're going to be talking about today, is BPSO in relation to long-term care. Now, the BPSO program, and in particular, the Best Practice Guideline Program, has been funded by the Government of Ontario since 1999. And this program was developed to develop and disseminate and actively support the uptake of best practices within organizations. And so with this program, a lot of what we do is support organizations to implement these guidelines. Next slide. This is an image of our program model. The first big circle at the top is guideline development. And so everything we do at RNAO is really revolves around our guidelines. And each guideline is developed through a very rigorous methodology. The big circle on the left bottom hand side is dissemination, implementation, and sustainability. So it's not enough for us at RNAO to develop guidelines. The next best thing is to support organizations to implement them. And finally, the big circle on the right bottom side is monitoring and evaluation. And through our program, we support organizations to collect data about how their implementation is doing and utilizing through a quality improvement framework for improved resident outcomes. Our long-term care best practices program has been around for about 15 years, and the whole purpose of our program is to support the improvement of resident outcomes through the implementation of best practice guidelines. And so when we look at this pillar, it's really looking at how do we impact long-term care homes at the system level. Next slide, please. And our best practice spotlight organization program is at the organizational level. This is where we work with individual organizations, long-term care, as well as other sectors to support the implementation of best practices. So what is BPSO? So BPSO, our whole goal is to support organizations as a whole to implement best practice guidelines. And the whole purpose, again, is to improve resident care outcomes. Next slide. And we do this through a 3-year contract. And so what happens is, if you are interested in becoming a BPSO, which really is about implementing guidelines, improving resident outcomes, and partnering with RNAO, then what's going to happen is over the 3-year period, you will be supported in these efforts. So when Sue Sweeney, she's going to talk about all these 5 sections, these 5 components of BPSO, and it is a purposeful methodology, you will have RNAO to support you all through the way. you'll have a coach, you'll have resources to help you through this program. And so I really want to reiterate that we at RNAO are here to support you to be successful through this program and to graduate. Now, the first part of the program is a pre-designation period. And so within those 3 years, you will need to commit to a certain number of deliverables, which we will support. And then after the 3 years, it's not finished. You'll continue your relationship with RNAO. Next slide. So in total, we have about 90 organizations, long-term care homes spread throughout the province who have signed on to become BPSOs. And globally, we have about 1,500 organizations throughout the world. And so really and truly, BPSO is a global network. By joining BPSO, you will be also joining the 1,500 organizations that are moving forward best practice guidelines. So that's just a very quick overview. I'm going to hand it over to Sue now, who's going to introduce us to some of our existing BPSOs.
Thanks, Janet. So good afternoon, everyone. So I have the opportunity to introduce Sarah Anderson from the Royal and Dorina Rico from Heritage Green. Hello. And we're just going to have a discussion and an interview regarding some of their experiences as BPSO. And so they've both been in the program for a little over a year. So I'll start with you, Dorina. Why did you decide to become a BPSO?
Well, I'll be truthful. I needed help. And every time I need help, I was new DLC at Heritage Green. I needed help and I go to RNAO. And I know, I do know, and I want to also introduce, I have the ADLC on the.
Hi, everyone.
So Tawinder is the ADLC, also new to Heritage Green. And together, we wanted to ensure that when we said, okay, we wanted best practices for fall prevention, reducing pressure injuries, we knew that we would get better buy-in from all our support if we say our goal was to reduce falls. Our goal was to reduce pressure injuries. So that is one of the main reasons. And we wanted to go to the best. And so if you're thinking, how do we do this? This is where you go. You go to RNAO. You want to add anything, Tawinder?
Yes. Since we joined with RNAO BPSO, our numbers of falls decreased, and the ideas and the strategies that we got from our coaches. I want to, say that Jennifer was our coach earlier. Then we got Danny, and they really help us with, new strategies, what we should do. And they always, Danny always attend all of our meetings, like falls every month. He tries to attend the meeting, and he also comes into our home to help us. And also with the family and resident PFCC, person family centered care, in that area also we are doing really well. We have done our gap analysis, which showed us that where we are lacking behind. So that also helped us a lot. So I really appreciate Dorina, she's always encouraging us that let's do something new, guys. So she was the one who really wanted to, come along with BPSO. And now the whole team is. Now we have the frontline staff who know about BPSO, and we have a lot of champions. And this month we are organizing another meeting with our staff where we will be encouraging everybody to become a champion. And even in our orientation, when we bring in the new staff, we ask them to become a BPSO champion. So in all our meetings, we talk about BPSO.
That's great. Thank you so much, Tawinder. Sarah, can I ask why your organization joined the BPSO movement?
I definitely have to mirror what Dorina was saying, that we needed help, right? And there was some, I was a new DOC to Royal Ottawa Place. So this is a 64-bed home in Ottawa. It's slightly, it runs, it doesn't have a special designation. It runs like any other long-term care home, but we just happen to have, we primarily care for people that have a severe mental illness, and it's usually a younger clientele that have been aging in place. So when I came to Royal Ottawa Place, I identified that in order to meet the Fixing Long-Term Care Act and also Accreditation Canada, we needed to have some structure and a protocol around wounds and around palliative care. So we were looking at the BPGs and we were looking into the BPSO program, and we thought we're going to be doing the work either way. It would be great to be able to get some support from the RNAO and to have a coach us through, guide us through, and have this structure to implementing this, because otherwise it can be so incredibly overwhelming to look at implementing these BPGs. But the BPSO, although it does look a little bit overwhelming when you're looking at this program, it is, it just pays dividends in so many ways, like which I know that we'll get into, but it really helps to clearly identify where you need to put your work, where you need to put your focus, and creating a framework in which to do those things. So I think we're about 1.5 years through currently of the 3-year program.
Great, Sarah. Thank you so much. And we heard from Talwinder and Darina the impact on residents, staff, and the organization. What's the impact been at Royal Ottawa with the BPSO?
Oh, okay. Well, the RNAO will know that I talk about this all the time. So when I started at Royal Ottawa Place, like, it was a really negative, toxic workplace. I think the union, both unions that we have for our nurses could have had offices in the building. It was just, it was a real challenge at first. And, you know, we were in the middle of the pandemic, and I'm here thinking of adding, you know, BPSO onto the workload. But I have to say that being a part of this program has completely changed the culture in the home. Not only has it given me, myself and the nursing manager and our PCA supervisor tools to help lead, it's also changed the culture because we create best practice guideline champions. And of course, at first, everyone was trying to remember, what is BPSO stand for? What is that again? What is a champion? What do they do? What do we have to do? Like, we're overloaded from COVID and the pandemic and different directives coming out every other week. But we really did make this exciting, and we had to be the cheerleaders to get that buy-in from the staff. But it changed the culture because now we have PCAs leading certain initiatives. We've just implemented resident rounding, and that's been led by our resident service coordinator and a handful of PCA or PSW best practice guideline champions. Our palliative guidelines we're working on now, and that's being led by 2 RPNs who are now doing that LEAP education and looking at NIPPSing to go on and do the RN. It really kind of stokes the fire and creates a lot of opportunity for teamwork. I happen to have one with me. We made team t-shirts. Everyone that becomes a BPG champion has, you know, the Royal and BPSO BPG champion on them, and we have t-shirt Tuesdays, and we all wear our t-shirts. We have resident champions now too. They've got t-shirts. We gave Doris Grinspan a BPG queen written on the back t-shirt as well. So it really does give you opportunity, and I know it sounds daunting, but it really does give you opportunity to change culture for the positive in your home.
That's great, Sarah. And we heard a little bit from Darina and Talwinder about their coaching and the support that the coaches have given. How about the coaches with you, Sarah?
My coach, I don't know if my coach is on here. Is Tanya on the call today? I would totally make her embarrassed, and but we can't do this without the coach. Like, our coach, Tanya Davis is our coach. We are so lucky. I know she looks after a lot of homes in the Champlain area, but she is there to keep us on track because I'm sure we've got a whole management team of people, and I swear we all have ADD, but wait, she keeps us on track. She makes sure that we are meeting those deliverables, because there are certain things, you know, that you have to, as part of your contract, that you, to keep you on track and make sure that you incorporate into the implementation of this program. But if she tells us when we're, you know, way up here and we need to pull it in and just, you know, make it a little easier on ourselves. She'll come up with great solutions for some of our problems. She helps keep us accountable, and she really ensures that we're going to be successful. Like that we will finish this in 3 years. We will become a BPSO, and we're already starting to talk about some of the other best practice guidelines that we want to work on. And I'm kind of where I'm also in the seat of director of nursing for the Royal. So I'm also starting to consider bringing the BPSO into the entire hospital. So it is, without Tanya, I don't think that without your coach, I don't think, you know, it would be much more difficult. And they kind of become part of your team as much as you feel a part of the RNAO. Like it's this very symbiotic relationship.
Great. Thank you, Sarah. I appreciate that. So I'm going to ask Tawinder and Darina, if you had some tip for those contemplating applying for BPSO, what would that be? Maybe start with Darina.
So one tip I think would be to make sure you have a team that is on fire, or you want to ignite them. Make sure you're in the readiness state. And I want to say that we talked a lot about it. We brought it to PSW meetings. We brought it to our nursing practice meeting. And so I did a readiness assessment that I was able to talk to the nurses on the front line. I was able to talk to also board members through our administrator. So one tip is, don't start it unless you're ready. And I am sure more than often people are ready. People want to be part of something. And I want to say it is excellent for retention rates for your nurses. The nurses want to be leads. So when you are doing your interviews, a good tip is ask them about what kind of lead do you like? Do you like to do fall prevention? Do you want to do pressure injury prevention, family-centered care? And you see them getting excited because you say lead. And it's a good what's in it for your agency, for anybody, the nurses from agencies, to be part of you. And so I'm telling you, it is a great strategy to get people to work for you. Talwinder, do you want to add a tip?
I think you covered everything, Dorina. So it's more like talking about BPSO. So we talk about it in every meeting.
Yes.
Right on our orientation, we start to talk about it. So yes, in the beginning, you know, we were not that organized, but Danny, like he's very helpful. He keeps us all, you know, on a track and he makes sure that we, you know, do whatever is needed to be done.
Great.
I wanted to add another tip. So
Sure.
when we went through CARF accreditation, oh my God, guys, CARF accreditors, they love to hear about RNAO and BPSO. So the respect that you get when accreditors hear that you're doing this journey, it is great. So please mention it when you're starting accreditation.
You're on mute, Sarah.
Sorry. You think that I would figure that out using Zoom all day, every day for years. Sorry, specific tips on engaging staff?
No, on homes that are contemplating becoming a
Oh, my
BPSO.
tips for that. Yes. Oh, yeah. I think when we were chatting, Sue, I was like, just do it. Like, if you're on this call, you're already thinking about it, like, just fill out the application and just get started. And you'll have this moment, like when you get into the program, you'll have this moment where you're like, what did I do? Right? Like this, it can seem quite daunting. You're not quite sure at first. What is it that they're asking me to do? How do I do this? Now that I'm a part of it, how do I do this? But everything is broken up in a way that it's so clear. You know, you go to, you have a meeting with the RNAO, you're joining all of these other homes that are joining for the first time with you, and you can collaborate and talk to each other. And it's just the powers and the energy in the room is all the same. You're all here to do the same thing. And it's a great way to network and also just get out of work and go somewhere and you know, do something different for a change, right? And but then, you know, once you get started, everything just kind of falls into place. You do a launch, you see how your staff slowly start to get on board, and some are usually, you know, as Darina was saying, are already ready for this type of change in the home. But you know, it really, just my advice, I mean, I know I'm a year and a half in, but it's just to do it. I wish I had done it earlier. I wish I had done it in other long-term care homes that I'd worked at. I wish I had done this years ago in my nursing career. This, you know, from a personal, professional point of view, even like being a part of this is the best intervention or implementation I've done in a home that I've worked in ever. So it really will pay off. I can't speak more highly about this program and what it does for a home and what it does for, you know, truly for residents. I know we've talked a lot about staff, but you're making the lives better of your residents, and you see it. You actually see this change happening in your home. So 10 out of 10, 5 stars, all that jazz. Like, highly recommend. Just do it. It's great.
Well, thank you so much, Darina, Talwinder, and Sarah, for sharing your journey with us. We truly appreciate it. Definitely all stars in the BPSO book of all stars. All of you are doing extremely well, and thank you for your time today.
Thank you, Sue. If anybody wants to call us, please let them know that they could definitely call us on our extensions, okay?
Okay, thank you so much.
Thank you.
So let's get into the eligibility criteria. We've heard from the long-term care homes, two outstanding long-term care homes who are pre-designates presently. When you can go to our website for BPSO long-term care, and you will see the RFP will be posted there. On page 19 and 20, you will see the criteria for becoming BPSO, and I'll go through it in detail here. Just so you know, RFP is exclusive to Ontario long-term care homes, and it is a selection process. And anyone who applies, it will be for the timeline of 2025 to 2028. It seems so far away, but it isn't. It's soon approaching. So I'll talk about the deliverables. And Janet had touched upon this, that it outlines two key responsibilities. The deliverables that a BPSO is committed to achieving in a contract period, and the supports that and responsibilities of RNAO. And this has been purposely assembled based on implementation science methodology. And when you look at these 5 components, I'll be speaking about each one of them, so in detail and collectively. But collectively, they comprise a system to develop the foundation of developing infrastructure, organizational and cultural change, and practice change to impact resident and organizational outcomes. So we're really looking at how can we get those outcomes for our residents and improve resident care. So at a minimum, long-term care organizations commit to a 3-year partnership with RNAO, and there is some financial resources that need to be contributed by the long-term care home. And they also agree to guideline implementation, evaluation, and sustainability during the initial 3-year three-year pre-designation period and as a BPSO long-term care designate. And as Janet alluded to, after your pre-designation, then you become a designate and the partnership continues. So BPSO infrastructure is the first deliverable that we'll be discussing, and that's very purposeful because you need to make a foundation of culture change and build a strong foundation for implementation and sustainability. So it's building that foundation. So we ask that you appoint a BPS lead and co-lead. And we really, it's kind of changed in years, but we're now asking for co-leads because we find that if you have 2 people leading it, if one happens to go out, there's a backup. We also ask you to establish BPG implementation teams. So these teams can be already created teams in your home, like your falls committee, your pain committee, but we do suggest that you have implementation teams for each BPG. Establish a BPSO steering committee, and this can be absorbed into your CQI. In fact, organizations who kind of consolidate into already existing formats really do have the ability to sustain much easier. Talked about financial resources, and part of your RFP will be a budget. Ensure safe storage of BPSO related records, and we'll talk about that, and sustainability plan. So capacity development goes hand in hand with creating a BPSO infrastructure. And we want to develop capacity. It's about building your BPSO team. It isn't just one person's project, it's a whole home. And really, when you're implementing BPGs like person and family centered care, it is a whole home activity. So we ask that you develop champion development, 20% of your staff, of your nursing and interprofessional and management staff. What we found and what science has proven is when the change is peer-to-peer and at the front line, that the sustainability is much more effective. As discussed by Darina, Talwinder, and Sarah, you will have a personal coach who will work one-on-one with you. We also have Knowledge Exchange, Clinical Best Practice Institute, and ACPF, which I'll talk about in more detail. So the Champions Workshop or Champions Training, there's actually 3 different ways in which your staff can get this. We offer it free of charge via eLearn. We have also have in-person for BPSOs. And then we also have eLearn and virtual blended series that you can utilize. What we found is a collective force that influences knowledge transfer and uptake of best practice guidelines. And what we found is basically champions training is how do you implement change and how do you continue to support it and sustain it? So how do you make a culture change within your organization? So we ask that you have a critical mass of up to 20%. We also have monthly knowledge exchange meetings, and Darina and Sarah spoke about this a little bit. Every month we meet as a group, the pre-designates, and we discuss activities, what we've done. We have mini lessons. It's really an opportunity to network with the BPSOs and really learn from each other. Once a year, we have an annual BPSO Knowledge Exchange Symposium. And in 2023, we were celebrating 20 years of BPSO and we had a 3-day event. This year, we'll be having a 1-day event in London. And these are great opportunities to showcase a wonderful work. We have posters, we have presentations and workshops. So it's a great way to network and to learn from each other. And it's a great opportunity to have an audience and colleagues who are all quality of resident care and outcomes. And then we also have the BPG Institute, and this year it will be at White Oaks, October 27th to 29th. And what this is a 3-day event to talk about BPG implementation, talk about the different types of how you can implement sustainability and challenges. And once again, a great networking opportunity. And then we have advanced clinical fellowship. So this provides a RN or MP with a focused, self-directed learning experience to develop clinical leadership or best practice guideline implementation knowledge and skills. A fellow receives support from a mentor, from their organization, and from RNAO. It's aimed at developing and promoting a nursing knowledge and expertise in improving client care and outcomes in Ontario. And there's different streams. There's clinical practice, leadership, and guideline implementation. And once again, you will have an RNAO coach who will work with you. They usually meet with you at least monthly in years 1 and 2, but it could be up to once a week. Also, they're available by email or phone. And also, we set you up with a mentor, formal or informal relationship, where if there's something that you're implementing and we know of a home who has done this well, then we'll link both of you together. And Darina and Sarah are both great examples of mentoring other organizations. So let's get into the heart of BPSO program, which is guideline implementation, and it consists of three big parts. First is the guideline implementation. So each home is expected to implement 3 BPGs. And transitions in care and person and family centered care are 2 mandatory BPGs. And then you can pick a clinical guideline of your choice. So if falls is something that you'd like to work on, then you can choose that. Pressure injuries. We have a whole list which will be included in your RFP. And then once you decide to do the implementation, then it'll be developing your action plan, doing a gap analysis, and comprehensive implementation. Those long-term care homes who have chosen clinical pathways, each clinical pathway guideline implemented counts towards your implementation with BPG. So it's very synergetic and work together. If you're a long-term care home with multiple sites, there's a couple ways you can apply for the BPSO. You can have all homes implement all 3 guidelines within the 3-year designation period, or you can have all sites implement person and family centered care and transitions in care, and then have one lead home who will implement the clinical BPG that you've chosen. And after you've finished your pre-designation period, you would roll out from the lead site to the other sites the BPG that that lead site had implemented. So it's completely up to you, and you can speak to your RNAO best practice coach regarding these alternatives if you have any questions. So one of the big resources and supports that RNAO will provide is the Leading Change Toolkit and the coaching support to utilize these 2 frameworks to implement your guidelines and to work through your BPSO journey. So the Leading Change Toolkit consists of 2 frameworks, the social movement to action, and the focus of this framework is to provide strategies on how to engage people and mobilize change. And then we have the knowledge to action framework, which is how do you take a paper guideline and make it come alive and turn it into real practice at the bedside in your long-term care home. So also I mentioned clinical pathways. So what RNAO has done is we've created a partnership with Point Click Care, and we've developed documentation within the Point Click Care system that incorporates best practice guidelines. If you are contemplating clinical pathways, we will have a separate application for those who are participating in clinical pathways. So you can look at that application if that applies to you. So monitoring and evaluation is about documenting your BPSO journey and submitting reports. There's a few ways that you'll document your journey. So my BPSO. So these are narrative reports and they're online. You would submit 2 times a year and share it with your organization. And it's a great way to kind of tell the story of your implementation journey. And twice a year, you'll meet with myself and the associate director and review how you're doing. It's usually after my BPSO submission, and these are great opportunities to really highlight the great work you're doing and kind of get a temperature of where you're at with your implementation. RNAO has a data repository called Enquire, and this is where you'll put your quantitative indicators. So uptake and sustainability, HR indicators, and clinical guideline indicators so that you can document your outcomes and have tables and print out. And you will get special training to work with the Enquire system and definitely get support from our evaluation and monitoring team. You will host a site visit from RNAO one time prior to your designate, but your coach will probably visit you throughout your pre-designation, and the site visit is part of the designation process. And also we have program evaluation, and we do have research opportunities that will reach out to you and ask you if you'd like to participate. So dissemination. So this is It's all about sharing. How are you going to share what you've done? And there's so many opportunities. Sarah and Dorina and Talwinder were a good example today of how they shared some of the things they've done in the journey that they've done. But you can present at a conference, at an RNAO event. You can publish an impact story on our long-term care toolkit. You can publish an evidence booster or participate in an RNAO committee. We also ask that you have a BPSO launch within your organization. So you celebrate this opportunity to become a evidence-based culture and organizational opportunity. You need to submit a manuscript and create a web page and with the BPSO logo and some information regarding your BPS journey. Some organizations do a newsletter, some have BPS Corner on their web page, so it differs with your organization. We ask that you have social media engagement. So if you have a Facebook page, that you highlight the work that you're doing, and public visibility. And I'll talk a little bit about that in the next slide. But really, having the BPSO logo on your signatures, having banners, really promoting the fact that you are a BPSO organization. And as Sarah and Dorina spoke about, when you say you're a BPSO organization, it actually does help with retention and recruitment. So, building a collective identity, and collective identity is one of the critical pieces of the BPSO movement. It happens when your personal identity becomes connected with a group, your BPSO and other BPSOs. And as Janet had spoken about, BPSO is international, and we have over 90 long-term care homes in Ontario who have joined the movement. So it is so important, and you can develop your collective identity, or your, I like to say, your BPSO footprint by banners, by pins, by lanyards, by t-shirts, as you saw Sarah had developed, um, bulletin boards, posting on social media, on your Facebook. So really having that collective identity and really sharing in the journey. So I'm going to pass it back to Janet, and she's going to talk about what RNAO program supports are.
Thank you so much, Sue. And as I mentioned before, this is a true partnership where we at RNAO are here to help you be successful and to get you through 3 years to graduate. So these are some of the things that we commit to you as a prospective BPSO. So you would have a dedicated BPSO coach that, as Sue had mentioned, would visit you in person and would have uh, webinars as well as meetings with you to coach you through the process. There is an orientation. So as Sarah had mentioned, you would join the other BPSOs that are going to be coming on board for cohort L in Toronto. And we would give you an orientation as to what BPSO is. You'll meet other homes and you will get to learn step by step the process. We also have many, many opportunities for champion development. And so we have in-person workshops, online, and we come to you to help you to organize that. We also have lots of knowledge exchange meetings. So just like you, we're all assembled today, and our knowledge exchange meetings are on a monthly basis, and we meet and we hear from each other. So we hear from all of our BPSOs, how they're doing, what's their progress, what's their challenges, and how we can provide solutions to each other and help each other. Support training for monitoring and evaluation. We are here to support with data collection and submission. And so we're here every step of the way to help you select, what is it are meaningful indicators for you to collect and how to input them the most simple way and time efficient way. Over time, there may be research opportunities that we might bring to you, and if you're interested in participating, and of course, dissemination opportunities to showcase your work. So just like today, Sue and I reached out to Sarah and Dorina and Talwinder, And we asked them to bring their words of wisdom to today's session. And those are wonderful opportunities to share your successes. So the application process is two parts. The first part is submitting a letter of intent. Now, this does not need to be formal in any way. The letter of intent is just an email. You send it to Sitlali and myself just to say, my name is, let's just say, my name is Sue Sweeney. I come from this home, and we are interested in submitting an application for BPSO. It could be just as simple as email as that. And it's not binding. So if you're going through the process and you change your mind, that's okay. The key is when you submit the letter of intent, that signals us at RNAO to give you access to the online application. The online application is really all the questions that you need to fill out. And so we only give access to the online application to those who submit the letter of intent. Okay, and so the online submission has specific questions, and they are outlined in the RFP that will be released tomorrow. So in terms of the review process, once you submit your letter of intent and then also your proposal, we have a committee. There is about 4 to 5 reviewers. And what we do is we review each of the applications and we score according to a matrix. And then what we'll know is we will inform everyone that applied about their status of their applications. And so this is not uncommon that if you may submit, there may be a follow-up by myself or Sue who'll say, oh, there's a few areas that we need you to clarify a little bit more through the process. And so it's really an open process. It's very stringent in terms of the review process, and it is a competitive process. But I really do like how Darina had mentioned, really determine your readiness. And as Sarah had said, if you're already here, then you're already ready to take that next leap. Next slide. So we have, this is the evaluation criteria. So as you are working through the proposal, you can think about where to put your most energies. The proposal is really your opportunity to tell us, RNAO, about you. You know, why are you interested in this BPSO? You know, who is supportive, and what are some of your infrastructures that you have already in place? What are some of the guidelines that you're interested in? And so this is really what this proposal is about. And this slide just outlines a little bit about where we put a little bit more effort in terms of the review criteria. And then most importantly is the due date. So the letter of intent is due October 21st. And right after we get all the letters of intent, we will open the online application on October 22nd. So you'll have about a month to submit your online proposal, but not to worry. When the RFP is released tomorrow, it really does outline all the components that you need to consider in terms of what will be requested in the online application process. A few tips in terms of things to really think about as you're putting your proposal together. Some of the things will take longer than others, so you want to prepare. One of the things is that we will request is letters of support. And so if you are looking for letters of support from your board of directors, medical director, from the CEO, individuals like that, the DOC, oftentimes letters like that, they can't be turned around very quickly. So there are some things in the proposal where you might want to spend a little time earlier on, and engaging your leadership about this project and getting their buy-in is definitely one of them. And as you're talking about it, you could ask them for a letter of support as well. So the full proposal deadline is on November 25th at the end of the day. And then from November to February, where we will release the results, that's where the review team will review each of the proposals. Okay, so key important dates, October 21st, the letter of intent is due, and then the full proposal deadline is due just before December on November 25th. The key here also is each one of you have a long-term care best practices coach in your region. And so we have your names and your emails. And so what we'll do is we'll connect you with the coach in your region, and you can ask them any questions for clarification about the proposal. And they will help you to really understand if there are any areas that you want more clarification as well. Okay, and so if you have any questions or queries related to the RFP, I really suggest you in writing send an email to Sitlali to my attention no later than November 18th, and we will respond to you and answer any questions that you have. The ideal is to send it in writing so we could provide you a formal response and a detailed response as well.